Hi, I'm Dr. David Verebelyi. I'm the medical director here at the Colorado Center for Photomedicine. Today, we're going to show you an IPL treatment. That stands for intense pulse light. This is a treatment that we commonly use for freckles and sun damage and even redness. Works pretty well for patients that have rosacea. This is our patient Christy here, and actually Christy used to have freckles just like this that are on her arm, on her face, but we've done some treatments to help those. But now she wants to get rid of some of the freckles on her chest and on her arms. So that's what we're going to do today, is we're going to be showing you the treatment on the chest here. Okay? In order to do that, the first thing we're going to do is we're going to clean that skin off. Alright, I know that's kind of cold. You doing okay? Alright. So as we do this treatment, you'll see pretty bright flashes of light. It'll be just a little bit hot. Okay, nothing too bad. We expect this skin to get a nice rosy pink color after we're done with the treatment. Alright, so we're going to get Christy some glasses, and I'm going to get some glasses. Alright, Christy, any questions before we start the treatment?
Nope.
Alright. So the first thing we're going to do is we're going to put a little bit of cold gel over the area that we're treating. Here's that cold gel. Okay, doing okay with that?
Mm-hmm.
Great. We're going to come all the way up here to her collarbone, because that's where her sun damage is. Alright, Christy, we're going to get started here. So, just like I said, bright flash of light, a little hot for just a second. So, here we go. Alright, on the count of 3. 1, 2, and 3. Is that okay?
Mm-hmm.
Alright, so here we go a little faster. Alright, so what we're doing when we do this treatment is pretty simple. This particular device uses a wavelength of light that collects in melanosomes. Melanosomes are simply the little dark pigment that gives the skin its brown color. And when those melanosomes heat up, they actually break apart and your body can get rid of them. This is the same basic effect whether we're talking a freckle, whether we're talking sun damage. There's lots of other different pigmented lesions that we can treat with this device. You can see the treatment's pretty quick. Christy, how you doing with this?
Good.
All right. There's lots of different IPL devices out there. The ones that tend to be a little bit better are ones like this that have a little bit of cooling feature in them. They tend to go pretty fast, and the wavelength of light is very, very specific. So we make sure that all we're hitting is those melanocytes, those brown pigments, and then a little bit of red pigment too. So if you have a little bit of extra redness, this can be a nice treatment for you. In general, treatments that depend on the size of the area that we're treating. The chest normally takes about 15 to 20 minutes. Faces maybe about 20 minutes. For these, we tend to do about 2 to 3 treatments to get a patient pretty much maybe 90% cleared. Darker pigment actually comes up a little bit faster than lighter pigment because it collects the energy more efficiently. Redness does tend to take a little bit longer. If we're treating redness around the face or the chest, that can take us anywhere from 4 to 5 treatments. Christy, you still doing okay?
Mm-hmm.
Okay, and as you can see, we're already over half done with this treatment. She's getting just a little bit pink here. And what we expect the aftercare to be on this is very simple. Those dark spots will actually turn a little bit darker as they're healing, and all that is the melanin breaking apart. So for maybe about 10 days to 2 weeks, what Christy will notice is that she's got what look like coffee grounds over the area that we treat. And then those will gradually flake off. You need to be pretty careful with those though. Blot those dry after your showers and things like that instead of really scrubbing on them, okay? Because that skin's going to be just a little bit tender. Aside from that, no major changes in the routine. I'd like you to try to avoid the sun whenever possible. That's the other thing that will help this from coming back. Most of these things are strictly from UV light damaging the skin and your skin trying to protect the DNA. That's why melanin forms. It's actually just a little shield for DNA. All right. We're almost done here. I'm going to do one little area up here by the collarbone. Make sure that we blend everything in nicely. Still hanging in there?
Yep.
Great. Other things that you can do to make this process move along a little bit faster are simply the arnica gel or aloe vera can help make that skin a little bit calmer after these procedures. Okay. So now that we're finished up here, we're just going to clean Christy off and we're going to put a little bit of cold pack over that area. All right, Christy, you did great. This is going to feel real nice here. Get a nice little cold gel pack and put that right over there for about 2 or 3 minutes, and then Christy's out the door. And we'll see her back probably about 4 weeks in order to do the next treatment.